Hi, everybody. Welcome to Laguna Honda. And before we get started, my grandmother spent over almost 14 years here at Laguna Honda, and so many of you took incredible care of Miss Camellia Brown. I want to give a special shout out to Denise and so many people here who day in and day out take care of some of our most vulnerable folks that rely on us to care for them every day. We are so grateful to be here with our Governor, Gavin Newsom. He's already hit the ground running, and we know from experience of being a former mayor of San Francisco, he understands intimately all the challenges that we as cities face, which really is going to be so incredible for our city and cities across the state of California for all the things we know we need to do to change California for the better. Laguna Honda is a key part of San Francisco's health network, which cares for 1 in 8 San Franciscans, primarily people who are uninsured, low income, or from our immigrant communities. It includes not only Laguna Honda, but San Francisco General and smaller clinics across our city and health services in our county jails. Here at Laguna Honda, more than 1,000 patients each year receive care for complex conditions like HIV and Alzheimer's and dementia and other mental illnesses and disorders, and rehab for patients who are suffering from strokes or brain injuries or spinal injuries or other traumas. These treatments require long-term and specialized care, as so many of you here know, and they commonly include medications as part of the treatment plan. However, it is a well-known fact that these medications are expensive and can drive up the cost of health care for millions of people who need these drugs to survive. The San Francisco Health Network is constantly working to find ways to save money on drug costs for uninsured patients. We work with federal programs like the 340B program that provides drugs at a discounted rate for some of our facilities, but facilities like Laguna Honda or our county jails, our behavioral health clinics, they don't qualify for those federal discounts. Not to mention, the medications used in treatment plans at these facilities are some of the most expensive medications. The Health Network purchases more than 3,000 drugs for patients who don't qualify for 340B discounts. And just the 25 most expensive drugs of those cost our city more than $17 million each year. When we have people struggling on the streets of San Francisco with mental health challenges and substance use disorder, or people spending thousands of dollars on life-saving medications for HIV and AIDS, or people fighting a battle with cancer, we need to be focused on helping them recover and heal, not whether or not they can afford to pay for the medication. This is the same case at many healthcare facilities, not only in San Francisco, but across the entire state of California and the nation. And this is why I am so thrilled to be joining Governor Gavin Newsom here today to announce that San Francisco will be joining the efforts to bring down medication costs in our city. We will work hard to bring down the cost of those medications. We've worked hard over the years, but we know there's so much more that we can do. And by joining forces with other counties across the state, we know that we can make a difference in the lives of millions of patients. We are joined here today by 2 other Bay Area counties in making this commitment, Alameda and Santa Clara County. And please join me in acknowledging our new Department of Public Health Director, Dr. Grant Koufax, who is here with us today. And at this time, I'd like to call to the podium Clara, who had spent about 13 years working for the Department of Public Health in San Francisco. She is an incredible healthcare advocate, now heading up Alameda County Department of Public Health. Ladies and gentlemen, Clara.
Good morning, everyone. It makes me so happy to see so many familiar faces here and to be able to bring my new county in partnership with my old city and county in this really exciting endeavor. Alameda County is pleased to stand with Governor Newsom to leverage the collective bargaining power of the state and its counties to lower the cost of prescription drugs for all Californians. I'd like to thank the governor for his leadership on this important issue. Alameda County's Vision 2026 is in alignment with Governor Newsom's Health Forward agenda. Vision 2026 is Alameda County's comprehensive effort to set a course for a decade that anticipates community challenges and maximizes our ability to meet residents' needs in this rapidly changing world. Vision 2026 foresees a thriving and resilient population where individuals and communities are empowered to overcome adversities and be supported so that they can grow, flourish, and be self-sufficient. Essential to achieving this vision is our 10X goal of health care for all, which seeks to ensure that every person in Alameda County has access to the care and services they need to live their healthiest lives. Governor Newsom's collaborative approach to containing prescription drug costs will put us one step closer to a comprehensive solution for affordable and accessible health care for all. Collectively, public health care providers and other safety net providers in Alameda County spend tens of millions of dollars each year on prescription drugs for our county's most vulnerable residents. While many of these drugs are acquired through the federal 340B program, which Mayor Breed just referenced, drugs purchased for individuals accessing our county behavioral health services or our inmates in our jail do not. This means that we are surely paying more than we need to for these medications, diverting valuable resources from other safety net programs and services. This presents an important opportunity for our county and others to partner with the governor's healthcare team to explore how together we can make drugs more affordable in our safety net healthcare systems. Additionally, this approach will foster regional collaboration through the sharing of information and protocols and best practices. Alameda County is looking forward to partnering with the governor's office and our county colleagues to explore the promise of this timely endeavor. At this point, I'd like to welcome Miguel Marquez, Chief Operating Officer for the County of Santa Clara.
Thank you, Colleen, and thank you, Governor Newsom, for inviting Santa Clara County to participate in this event and in this work, and thank you, Mayor Breed, for hosting this event today. Over the years, Santa Clara County has implemented programs to expand coverage and affordable options that move us closer to providing health care for all. Indeed, our Board of Supervisors has officially supported a single-payer health care system. In Santa Clara County, we are proud to operate 3 hospitals and a dozen clinics located throughout the county, each of which provides high-quality, integrated health care to the 2 million members of our community. Like the governor, we know that innovations to our healthcare system, including a path to single-payer system, will help us reach our shared vision of better health for all. That's why we're excited by the opportunity to work with the governor and with so many other partners throughout the state to take on the high cost of prescription drugs. Year after year, pharmaceutical companies continue to increase the price of brand name drugs. We all need to ask the question, do prescription drugs really have to be that expensive? While drug purchasing practices are complex, we must look for and implement innovative solutions to reduce these costs. Federal policies have not done enough to control drug prices. In the absence of federal leadership, local and state governments need to partner and need to think creatively about how to leverage our collective buying power to negotiate better prices for our residents. Last year, Santa Clara County Valley Medical Center spent more than $120 million on pharmaceuticals. Given the extraordinarily high cost of prescription drugs, we've been looking for opportunities for savings. We welcome the chance to work with the state and with other partners to explore options to reduce these costs. As you know, public health systems play an especially important and unique role in delivering care, services, and treatment to the patients and the communities we serve, especially the uninsured and the underinsured. We are a safety net healthcare system that is proud to offer top-notch care to all who need it. But to do that, we need to explore all opportunities to reduce costs whenever possible so that our limited resources can better be spent to help the homeless, the mentally ill, and other vulnerable members of our community. You know, a number of years ago, the County of Santa Clara was the first county in the nation to ensure that every child, regardless of immigration status, could get healthcare services. Having led the way on children's healthcare, we are especially proud to support the governor's efforts to become the first state in the country to provide coverage to young, undocumented adults through Medi-Cal. Thank you, Governor, for leading the way for these young adults. Santa Clara County and the state of California have aggressively implemented the Affordable Care Act. It's been a huge success. Just a couple of numbers. In Santa Clara County alone, more than 130,000 residents gained coverage through the Medi-Cal expansion. Another 45,000 plus have subsidized coverage through Covered California. Again, that's just in Santa Clara County. And most important, the bottom line number, the uninsured rate in Santa Clara County has dropped by 53%. So the time is now to take the next step. We are fortunate to have a governor who is a champion for these important issues. We look forward to working with the governor to make better health for all California's highest priority. Thank you very much.
Thank you, Miguel. I also like to take this opportunity to introduce someone who's really been a champion for Laguna Honda. Our supervisor for District 2, Catherine Stephanie, is joining us here today. Thank you so much. And now I'd like to introduce our governor, who we all know was a former mayor of San Francisco, someone who led innovative programs, pushed to really change San Francisco and California for the better. You know, same-sex marriage, he was the one who put forth the idea and opened the doors for so many people to get married at City Hall when so many people attacked him on this issue, and now it's gone global and been recognized throughout places throughout the United States. 311 was just his brainchild, this innovative resource that we use to call to deal with a number of challenges in the city. Care Not Cash, so many incredible resources that we use today. And now, as governor, in his budget, he will continue to provide the support and the resources that we need to really address many of the challenges that we know exist in San Francisco. But also, you should know that he really led the charge on the rebuild of Laguna Honda Hospital to the new facility that we see today. Ladies and gentlemen, the governor of the state of California, Gavin Newsom.
Thank you, Madam Mayor. Well, this is fun coming back. A couple of you were showing me photos 10 years ago, you know, pre-gray hair, and it was remarkable that this place opened. I remember standing here during that ribbon cutting. I think I used a line from Pericles, which I now reminded of. It said, at the time we were doing something, you know, who opens skilled nursing facilities anymore, right? 10 years ago, that was novel. No one was reinvesting. People wanted to mothball this place. People said the county can't afford it. We got to move in a different direction. There's still raging debate, and we get it when it comes to skilled nursing facilities versus keeping people in place and the like. But it was interesting at the time. We were on the leading cutting edge of doing something no one else was willing to do. And I remember saying that Pericles, and you forget he was mayor, Pericles, of Athens. He said to the Athenians, he says, "We do not imitate, for we are a model to others." And I said that then, 9+ years ago. I'm going to say it again today in the context and the spirit that brings us here together around the issue of prescription drugs. We do not imitate, for we, California, are a model to others. What we are advancing here today is novel. What we are advancing here today is new. What we're advancing here today matters. What we're doing here today is something I expect others to be doing tomorrow, not just other counties joining California's purchasing pool, but other states joining California's purchasing pool, leveraging our resources. Big buyers mean lower costs. And the fact is, in the state of California, $13+ billion a year of your tax dollars are currently being spent on prescription drugs. I'll repeat that, $13+ billion a year. The problem is we were isolating the purchasing. We had jails doing their purchasing. We had the state hospitals doing their purchasing. We had our retirement system doing their purchasing. We had the VA doing their purchasing. We had our Medi-Cal system, which is 13 million strong. We were only leveraging 2 million of those 13 million in our purchasing pool. Just combining the Medi-Cal system alone, taking the 2 billion and leveraging the purchasing now with 13 billion is going to drive hundreds of millions of dollars of savings on an annual basis. We project in our budget we just submitted a few weeks back or a week or so ago that we will save conservatively $393 million because of this purchasing effort. That's just on an annual basis, $400 million of money that we wouldn't otherwise spend that will allow us to provide discounts, to provide additional subsidies, to reduce those costs to each and every one of you. If we're not serious about pharmaceutical drugs, we're not serious about addressing the cost curve as it relates to the issue of healthcare inflation. This is one of the principal drivers. We've seen close to doubling of our costs in the state, doubling of our costs in the state just in the last 9 years. This cannot continue. And with all due respect to Big Pharma, I have no problem, no gripe with people being successful. I don't begrudge success. I appreciate competition. I appreciate research. I appreciate the kind of innovation that we pride ourselves and the industry prides itself on, but I don't like people taking advantage of other people. I don't like gouging. I don't like windfalls. I don't like folks, getting massive bonuses and, at the expense of folks that are struggling out on the streets and the sidewalks. This is a foundational principle. It's a value I know the Laguna Honda community shares. It's a value San Franciscans share. It's a value Mayor Breed shares. It's a value shared broadly throughout this state and substantively around this region in Santa Clara, in Alameda County. That value now is being brought to the fore in terms of now counties joining the state purchasing pool. We had hoped this would happen in a year or two, maybe 3, but here we are just weeks after announcing LA County joining our purchasing pool. Now 3 additional counties are joining the purchasing pool. This is remarkable. The momentum is real, and this is exciting because we're actually making progress in real time. This is not just platitudes. This is not just a tweet. This is not just a promotion. It's not just a promise. We're actually seeing things happen in real time. And so I just want to thank the enlightened leadership that you heard from today. They didn't need to do this. It was wise to do it, but they didn't need to do it. But the fact that they're doing it, and they're doing it on the front end, is an extraordinary testament to Mayor Breed's commitment, not passing interest, to bring down the costs of prescription drugs and the cost of health care in this county. Colleen's commitment and Miguel's commitment to do the same is a big deal. And so I don't want to undersell this moment. I want to appropriately sell it. I don't want to overhype it either, but this is significant. We have governors now calling this state, wanting to join our efforts. We believe this is the beginning of a different frame of momentum, not top down. God bless watching Congress pretzels try to deal with Big Pharma. This is bottom up. It's a new frame. And I'll tell you, California, we just reached that $3 trillion a year mark. You want to, we punch above our weight, and yet there are only 4 nations on planet Earth that carry more weight than the state of California. We are truly a nation state, the 5th largest economy in the world. The United States, one of those economies ahead of us. Only a few others that have the capacity to do what we're doing as a state. Now the 2nd largest purchaser outside of the VA in the United States itself in the country. This is important. So I want to just express and acknowledge the hard work of our team in Sacramento that's working overtime to get this right, to make sure we do it right. I want to thank the counties for building that momentum. And I want you all to know that we're now inviting the private sector to join our purchasing pools. We want to see companies, large and small, also join in and take advantage of our ability to leverage and to sit at the table as one purchaser, not disaggregated as thousands of purchasers, where pharma has the power. Now we're taking back that power and we're leveraging that power over the table. Humira costs 96% more in the United States than it does in the UK. Any of you on Xarelto, you paid 100% more than the folks in the UK. Give me a break. With all due respect, it's not just about, well, we do the research and development and we've got to pay for that. You know who does most of the research and development? You do, through the National Institutes of Health, through our grants, through our tax dollars. They leverage those, they supplement those, and we're proud of that research, but give me a break. They do it because they can. They do it because no one's pushing back. They do it because they leverage influence with people like me. They come in with a lot of money, and they come in to leverage their point of view. And they usually scare folks from doing the right thing. But they can't scare the leaders assembled behind me, and they cannot change the trajectory of a state that says, we've had enough, we're better than this, we're going to do more, and we are going to leverage our voice in a way that respects the people of this state that we represent. So thank you all for coming out. Thank you for being part of this announcement and all this extraordinary momentum. And know this in closing, this is just one of many things the state of California is doing to expand health care in this state. Our budget, briefly, is going to expand coverage regardless of your immigration status, 0 to 26. Our budget's going to double, substantially rather increase by doubling our annual contribution in our Medi-Cal system through Proposition 56. Forgive me for boring you on that, but we're going to significantly increase our provider reimbursement rates, more trauma screenings, more early screenings to address issues before they manifest on acute frame. We are going to deepen subsidies for low-income families on the health exchange and expand subsidies into the middle class, the only state in America that is expanding subsidies for families earning up to $150,000 a year. We're very proud of these efforts. Our goal is universal. Our goal is to get this done through a single-payer financing system, but until we advance those ideals, we're going to build pragmatic steps, make progress each and every week until we ultimately get to those goals. So thank you, San Francisco. Thank you to Mother Nature for adding a little energy outside, and thank you to Mayor Breed for hosting us here today. Thank you all. I don't know if there are questions or how you guys want to do this. I want to let the mayor go or let the electeds go, and supervisor, very wonderful that you're here as well. That's an important seat, District 2. Any questions, or you want to do it over here? We're going to do it out here. So we'll let you all go. Thank you guys very, very, very much for taking the time to be here.